Good afternoon. It's great to see you here today on Tuesday at 2 o'clock. And we're so thankful for the opportunity to share with you the do's and don'ts of Medicare. Today, what we're going to be talking about is we're going to be talking about the countdown to AEP. What is AEP? AEP is the annual enrollment period that everyone who already has Medicare, whether it's Medicare Advantage or Medicare A and B with the supplement of Part D, you can all make new choices, and a lot of people want to do that. So it's very important to get ready. The second thing we're going to look at today is this question. I am 65, okay, 65, but I plan to keep working full time, and if I keep working full time, is it better to keep my employer's health insurance or to get Medicare? Is it better to keep my employer's health insurance or to get Medicare if you keep working? Very important question, very important one to understand and to think about for yourself. But we just, have to understand a number of things when it comes to that issue. My name is Dennis Richards. If you don't know me, I am here in Palm Beach Gardens, Florida. Have been for nearly 16 years now, really over 16 years when I think about it. I am a state of Florida licensed insurance professional, and I'm a member of the National Organization of Insurance Professionals. I'm a Medicare specialist in the state of Florida, and I've been working with people with Medicare for many years now, and I want to thank you for being a part of our program and allowing us to come into your space and to get to know you and be a part of the community with us. So we're going to go right ahead to the question that we're looking at this week, and that question is a very important one, and that is, if you're 65 and you think you want to keep on working, which some people certainly do, and there's nothing wrong with doing that. What do you need to understand about your options in terms of all that's going on with turning 65? Well, the first thing that you have to understand is this. You have to understand that you have some options, and those options are, first of all, you need to know if you're able to delay Medicare. You are required to take full Medicare benefits, both A and B, if you are turning 65 and if your company has less than 20 employees. I'm going to repeat that because that's important. You're required to take full Medicare benefits, both A and B, both parts A and B, if you're turning 65 years of age and if your company has less than 20 employees. Generally, if an employer has 20 or more employees, and coverage that is considered credible, you can delay without penalty. However, some larger employers have different requirements as well. That's especially true if you're working and have health insurance through your spouse's employer. So if you're working and your health care is through your spouse's employer and you're turning 65, you need to definitely check to see if you can stay on your employer's plan. And how do you do that? Well, there's several ways, but basically you need to check with your benefits administrator at either your wife's or your spouse's employer or your own employer to be sure about what's going on and what you need to do and whether or not you can stay on the health insurance plan that you have, or whether you definitely need to go ahead and get onto Medicare. Very important that you take care of that, because if you do not get the information correct that you need to know, and you wait and you are not enrolled in Part A and B when you should have been, you may wind up paying a penalty for the foreseeable future. So you don't want that to happen. So we're going to move on to our topic of today, and that is the annual election period for Medicare. Believe it or not, it's going to be here in just about 1 month, October 15th. And to many people, that's not something of any consequence, but to those of us who are on Medicare, we know that before we blink twice, we will be being asked whether or not we want to stay in our current Medicare plan or do we want to change to a different Medicare plan. It's very important that you start looking at your current Medicare plan and evaluating a number of things in advance of the actual date of October 15th, because until you've been able to assess what your situation is and whether or not you're happy, whether or not you'd like to make a change, whether or not there's a change that would work well for you, the list just goes on and on. And most of the time, you want to have discussions about all this with a Medicare specialist, someone like myself, who can give you some good answers and good options and help you make the right decision for yourself. So we hope and certainly encourage you to start now. Don't delay thinking about what's going to happen as of October the 15th. One other reason that you should make some decisions now and make your determinations is that what happens to us is as life moves along, we often think we're going to get around to it, and we're going to get around to it, and then we're at October 15 and we still haven't gotten around to it, and then we're at November 15th and we haven't gotten around to it, and we get to December the 7th and AEP closes and we still haven't made any decision or changes. And when December 7th comes, then it's too late to do anything for the next year. And you don't want to be caught in that situation if, in fact, you want to make some changes. So we're going to look at one change or one specific issue for each of the next 5 weeks related to the countdown for AEP. And today we're looking at how to get ready for yourself through reviewing your coverage. Reviewing your coverage. I would say that if I ask any number of people on the street what kind of Medicare they have, a lot of them would take a long pause before they answered, and some of them would not be able to give an answer for certain as to what kind of Medicare coverage they have. Why? Because we sort of take things for granted, and if we've had our policy and our plan for some number of years, we take it more and more for granted, and it's just a matter of fact. We have coverage and we just go ahead with things as they are and don't think much about the particulars. That's not a good process. The process is that you need to review your current coverage every year. I'm going to repeat that. You need to review your current coverage every year. It's important to take time to review what you currently have. And you can do that easily. You should have in your wallet, your purse, or somewhere a couple of cards, at least a couple of cards. Generally, you're going to have a Medicare card that's an A and B red, white, and blue card, and you're going to have either a Medicare supplement card or you're going to have a Medicare Advantage card. One of those two to go along with your Medicare A and B red, white, and blue card. You're going to have one of those cards. Those two cards indicate very specifically what kind of coverage you currently have. Now you might also have a Part D plan, a PDP plan card as well for the company that supplies you with your medications. But certainly you're going to have the first two cards, and once you have the first two cards, you're pretty much going to know what kind of coverage you have. Okay, so you understand what kind of coverage you have, but now it's very important that you take the time to look back on the last year and to review your medical bills that you've incurred. Go over your expenses, which includes co-payments, co-insurance, premiums, and deductibles. I'm going to say those 4 things again. You need to review your bills go over your expenses and look at what is included: co-payments, co-insurance, premium, and deductibles, because all those, add up to your bottom line in terms of what you're paying for Medicare and what it's costing you out of pocket. So when you do all that, you're going to then get a clear picture of, do you think you're happy with what you currently have, or do you feel like you need to make a change? Okay, here's some questions that you might want to ask yourself about your Medicare review of coverage that you have. Did your costs fit comfortably within your budget, or did medical expenses cause you to have financial stress? Pretty easy to answer. If you're happy with the coverage that you have and it fits into your budget, great. But if you have medical expenses that are causing you financial stress, that's a real indicator that you probably want to look and see if there are other options for you to consider that might help take some of that burden off of you. I will tell you that there are many different aspects or approaches or options to Medicare and Medicare coverage that, if you're feeling financially stressed by the cost of your Medicare and Medicare benefit, you certainly need to be asking questions and certainly need to be getting answers based on what could I do instead of doing what I'm doing now. Okay, that was question one. Question two is, have you experienced any unexpected changes to your health that require different prescription drugs or more doctor's visits for the foreseeable future? In other words, has your health situation changed? If your health situation changed in the last year, you might want to look at what other options you might have if you think your health situation has changed permanently and you're going to be continuing to have more prescriptions and more doctor's visits. Did you have a health crisis or event that left you with overwhelming out-of-pocket costs? If you found yourself having a major crisis, a catastrophic health event of some kind, such as a heart, stroke, something like that, heart attack or stroke, that, or cancer, then you certainly might want to look at, if you have overwhelming out-of-pocket costs, you might want to look at whether or not, that's the situation that you want to try to steer away from as far as the upcoming annual enrollment period and choose a different plan. Number 4 on this list, has your living arrangement changed in some way? Did you move in and out of a skilled nursing care? All those different possibilities. Have you moved from one area to a different area? So forth and so on. So many different things. But if your living arrangements have changed, you really need to look at it. And then finally, have you been diagnosed with a chronic illness or disease that may change your coverage need? If you have a diagnosis that says, okay, you do have, this or that or some other situation such as cancer, how is that going to affect you for the foreseeable future, and what do you need to do in order to address that? So review your current coverage, your co-payments, your co-insurance, your benefits, your deductible, and ask some very probing questions. Evaluate your current coverage, determine how well it has met your need over the past year, and then ask for help to make an informed decision. What kind of help? The help that comes from someone like myself, who's a Medicare specialist, who can answer your questions about what you paid, what the upcoming plans for 2022 might be like, that might be different than the plan you currently have. So many different things that you can get information from about what you need to think about prior to October 15th. October 15th becomes like a floodgate being opened for all Medicare specialists, because everybody wants to get things taken care of ASAP, which we certainly agree with and we understand. but it's not necessarily easy to deal with a lot of people at the same time. So we encourage you to be proactive. We encourage you to think about what you need to do now and do as much as you possibly can beforehand so that pretty much your decision is made. And then come October 15th, you could put in a new application if you decide you want to change. If you don't want to make a change, then you're pretty much set to go and don't have to be concerned about it. We're going to continue to look at the countdown for AEP, or annual enrollment period, each Tuesday at 2 for the next 5 weeks. There are 5 important things that you need to do or to consider in order to be ready for the AEP. I hope this has been beneficial today. I want to thank you again for being on the program with us. We appreciate so much we appreciate those of you who make up our community of people who are concerned about Medicare. And I'm going to end today by saying what I think is so important. You need to remember to take care of your Medicare, because someday you're going to want your Medicare to take care of you. Until we meet again next Tuesday, be blessed, be safe. Thank you. I look forward to seeing you then.